Hey there, Dr. Shelby here at Evolve Chiropractic in Woodstock to continue on our vitamins and minerals series. So today we're going to be talking about zinc. So zinc is incredibly important for a lot of nervous system functions. It is essential for growth in our body. We've got things like eye function, hearing, taste, immune function, wound healing, and it also has a lot of oxidative properties, as well as some antiviral properties for certain viruses. So zinc is incredibly important during your journey of healing. Now, zinc can be found in a lot of different foods naturally, so like chicken, red meat, fish like sardines, salmon, legumes, so like chickpeas, pinto beans, different things like that will all contain minute amount of zinc, which can be very beneficial for your overall healing and health. Now, in terms of how much zinc should we be getting a day, right? Now, it varies from age to age and obviously men to women, but on average, an adult woman, so someone over the age of about 18 years old, should be getting about 8 milligrams of zinc per day. For men, again, over the age of 18, about 11 milligrams of zinc per day. Now, for a lot of people, you can naturally find zinc in a lot of our foods that we have nowadays, which obviously is incredibly important. Zinc is very beneficial for protein uptake as well, which again, protein is the building blocks of muscle and a lot of DNA synthesis and growth functions within the body. So zinc is important to help with that protein synthesis here. So the nice thing is, as long as you're eating a lot of these kinds of foods with chicken, red meat, fish, legumes, different kind of dark leafy greens, all of those contain zinc. Now, what can start pulling zinc out of our body or create malabsorption of zinc or not absorbing the zinc as properly is a compound called phytate. Now, phytate is found in a lot of soy compounds. So you'll find this in a lot of your like plant-based foods. So like your Impossible burgers, your soys, your different foods that do not contain the more natural animal proteins there. This can also be found in like wholemeal breads as well. Now, who is at risk for becoming deficient in zinc, right? Because like I said, a lot of, if you're eating a well-rounded, well-varied diet, you will be getting enough zinc in your diet. But for those who are vegans, vegetarians, so people who are not eating more animal-based proteins, also people with like gastrointestinal diseases like Crohn's, so those malabsorptive gastrointestinal diseases, women who are pregnant or breastfeeding, people with sickle cell anemia, and those with chronic kidney disease. So all different like types of malabsorption conditions can reduce the amount of zinc we're getting. So supplementation for those people can be key. Now, zinc can be found in several different forms or variants, but most supplementations will have just kind of a generic level of zinc or a generic compound of zinc. So most supplementations are good for your zinc absorption there. If you do find yourself thinking that you might have some zinc malabsorption, what are some things you should look out for? So things like diarrhea, nausea, vomiting, decreased immunity, thinning hair, impaired taste or smell, dry skin, infertility issues, impaired wound healing. So if you feel like any of those things kind of apply to you, maybe look at your diet. Are you getting enough zinc? On average, most adults are, but something to think about. And if you need to, always talk to your doctor about some supplementation. I hope this information helps.